One in three doctors suffers from burnout. Is this shocking news to you? I mean, it's Christmas and you're either on call or you were on call last year and feel lucky that this year you actually get to celebrate the holidays with your family and friends. Look around you and look within. If you're not feeling burnt out yourself, I'm sure you can easily name a handful of your colleagues that you're pretty sure are burnt out. Let's run through some numbers together. The 1 in 3 that I mentioned, that figure is worldwide. In the US, it's worse. This is the first year in 4 years where burnout rate among doctors has dropped to below 50%. Currently, it stands at 48.2%. Now, that's almost 1 in 2 doctors. This is actually considered an accomplishment as burnout rates skyrocketed to a record high of 62.8% in 2021. Healthcare is the second profession with the highest burnout rate, falling second only to project management in a recent LinkedIn survey. Now, this is not what you probably thought you signed up for when you were ecstatic that you got into medical school. I'm an internal medicine resident, currently working in the NHS, and at times I have suffered to juggle everything as well. Everything that's required of you and everything that you need to do at the same time. I've seen the same in my colleagues as well. If you think it's too much, it's probably because it is too much. You have to work long 12-hour on-call shifts, weekends, bank holidays, nights, all the while maintaining a portfolio of teaching and presentations and publications. And if you're in residency, you have to study for and pass your membership or board exams, all in your own time somehow. Now, this is not just a bleak video on how we as doctors are all screwed and we'll all burn out at some point. In my medical career so far, be it through my own experience or advice, I've picked up a few tips that have helped me personally avoid burnout. Now, do stay till the end of the video and we'll go through them together. First things first, remember that you're not alone. If you're feeling overwhelmed, you might think it's only you. And that's because, unfortunately, you only have access to your own mind. And you can't see what's going on in the minds of those around you. But I would bet that others around you feel the same or very similar. But it's easy to feel like you're completely tired and burnt out, while the others around you are doing great and they're thriving. But as the numbers show, it's not just you. On a typical on-call where there are 6 of you, statistically 2 are suffering from burnout. Now, realizing this is important. If you're suffering from burnout, reach out. Reach out to friends, to colleagues, and most importantly, to your seniors, because it's really more common than you think. And you have a clinical or educational supervisor or your line manager or consultant, and they're all there to support and help you. Most establishments nowadays realize how prevalent burnout is, and they have a system in place to help doctors suffering from it. Working as a doctor, you come across many life or death situations, and extremely likely that somewhere in your career you have done something or you will do something that will directly influence life or death. Now, this is a lot of responsibility, which might be why a lot of us have very good work ethics. But this does not mean that you can do everything. It's okay. It's perfectly fine to say no. It's okay to tell your colleagues or your seniors that you have too much going on. You have too much on your plate. Say no to taking on that extra quality improvement project or collecting data for your consultant's research project if you're feeling that you're stretched out thin. If there isn't a pending emergency, hand over whatever you have left at the end of the day and get home on time. Now, I can't stress this enough. A hospital is like a giant non-stop machine. And if you practically live there, it will consume you and grind you up. So remember, however important of a job and huge of a responsibility being a doctor actually is, at the end of the day, it is your job and not your entire life. Keep that work-life balance. Now, another thing that really helps to prevent you from burning out is to not treat your medical career as a rat race. At times, I've noticed that I've felt stagnant or didn't really feel the weight of my accomplishments. And the main reason, I believe, is that everyone around you is more or less doing the same. You got into residency, well, so did most of your colleagues. So it didn't really feel like an accomplishment. You passed your postgraduate exams, your MRCP Part 1 and MRCP Part 2, but you look around and your colleague passed them 6 months ago. Or you even have that one weirdo friend that passed it both parts as an F2, and suddenly you feel like you're actually behind. But you're not. You're really not. But because everyone is progressing at a relatively similar pace, when you compare yourself, you seem stagnant. It's sort of like going at 70 miles per hour on the motorway next to a car going at the same speed. You both seem stagnant. When you look out of the window, it doesn't seem like any of you are moving, but you are. And talking of comparisons, don't compare yourself to your colleagues. You go at your own pace. If your colleague wants to be a neurosurgeon, but you want a better work-life balance and want to become a GP, well, there's nothing wrong with either of those choices. None of them is better than the other. If you want to delay that exam to next year because, well, it's just too damn hard right now, then delay it. If you want to wait another year because you're unsure what specialty you want to choose, well, wait. This 1 or 2 years really doesn't matter that much in the long run, even though it seems like a huge deal right now. And lastly, remember to debrief and de-stress. If you're part of a crash team or manage medical emergencies, it's very important to sit down after the event with the team and have a debrief session. Discuss what happened, why it happened, and what could have been done differently. This is important for both learning and reflection, to improve your clinical practice, but also to really take in what happened. Aside from this, also sitting down with a colleague or a senior and sharing your feelings in confidentiality to process what happens and de-stress is very important. If, say, you were doing CPR and you felt a rib break under your palm, or you're a new doctor and you saw your first patient die, or you had to sit down in the emergency room to have a discussion with an overdose patient about whether they were trying to commit suicide or not. I mean, these things happen all the time in our line of work, and it's not easy to process. It certainly leaves its mark, and talking about it in confidentiality with one of your colleagues and sharing your feelings is very important in appropriately processing these feelings. You hear doctors who've practiced for decades say, well, you get used to these things, but I don't think you do, and I don't think you should either. You need to learn how to process them. Becoming devoid of emotions isn't the way to deal with these repeating difficult situations. Processing your emotions the right way is the right thing to do. Now, this keeps your empathy, which I can argue is the most important skill to have as a doctor. So take care of yourself, please, doc. If you don't take care of yourself, you can't take care of others. To summarize, please remember, you're not alone. It's okay to say no. It's not a race. Go at your own pace. Don't compare yourself to others, and de-stress. Please like the video if you enjoyed the content, and subscribe for more. If you're still here, which I really hope that you are, check out this other video somewhere on the screen to learn about your sleep cycle and what you can do to improve it. It really contributes to your well-being. This was Dr. Yad, and I will see you soon.